Okay.
So the COVID-19 is a global pandemic of unprecedented scale, sparing no single territory on the face of the earth since Big declared a pandemic in the second week of March. COVID-19 has infected 1 million people here in Africa. Though Africa has suffered a far lower mortality rate compared to other regions in the world, the disease threatens to outstretch Africa's health system. To help us assess the impact of COVID-19 on the continent, I'm joined by Dr. Jeff Kaluyu, a holder of a PhD in urban health research and policy. Karibu, Dr. Jeff Kaluyu. How are you doing?
Very good, and thank you so much for having me. Glad to be talking to you about this issue of coronavirus.
All right, great. So, Dr. Kaluyu, I'd like to ask you, Africa's situation with regard to COVID-19 is still on the rise. What plan do you propose to curb the rise here in Africa?
Well, it is true that it is on the rise, but in general terms, globally, it is rising at a lower rate than other countries. Of course, there are many contributing factors, because the economy not as rampant, not as active, and there are no planes that were flying from one place to the other. So we were behind the curve in terms of getting infected with coronavirus. But there are many, the rise that we have is at a slower pace, which is good for us. However, when we talk of rising, it is not a good thing at all. There are measures that need to be taken so that we can totally slow it down. We are actually at an advantageous position in the sense that we can learn from those countries like China, like United States, like in coronavirus has been really rampant, and we are able to correct course, and that gives us that advantage, along with other measures or other elements like environmental conditions, because coronavirus does not survive in a very high heat. Africa is between 30 degrees to 40 degrees Celsius, and that is not very conducive, unlike the winter that is being experienced in the United States, that is being experienced in Europe and other countries. So I propose that we use the measures that are actually working in other countries, and that includes making sure we do have social distancing that is happening. I recently proposed a 6-point plan, which I believe could be used as a infrastructure or a basis or solid foundation to make sure that coronavirus does not continue rising. And I would say, number one, for one, we do quick response whenever anyone has been infected or any case has been detected or reported. We do what we call quick response, at the same time not just being quick, but also making sure we protect our health workers, because they need to have the correct masks, which are N95s, and also making sure they have the gowns in case of the cases where they are handling the dead. So that is very important, quick response. Number two, we want to make sure there is extensive tracing. We want to make sure people can be traced very quickly. We want to be able to know who is doing what. That is public health. That's how public health works. Tracing people, who contacted with who, and how many people. Counter current unit multiplier effect. 2 people, contact 4, 8, 16. We follow those, and we need to have those people in the field. Isolation, to make sure we are talking of social distancing. but I really feel it's physical distancing because human beings are social animals. So when we talk of social distancing, you and I now, we are interacting, it's still social interaction, but we need to have we have physical distancing. So we need to be able to give these names as they go forward. As a PhD, I'm allowed to dispute some of these things, and I feel strongly it should be called physical distancing, but social, we need to be together so that we can share information for mental sanity, because World Health Organization, the WHO, usually defines health as physical and mental. So that social distancing, I think we may need to do some more other things to make sure it works. And then comprehensive, we need to have transparent information. A lot of times, people information that is correct across Africa. Now, and this coronavirus has brought this situation where the governments need to realize people need to trust them. In other governments, they are kind of getting instructions correctly, but in Africa, there has always been the politics in it, whether it is being trusted or not trusted. So I want to ask African governments to be compassionate as they talk to the people, which means that we don't act like headmasters where we want to tell people, you stop, you do this, you don't have no time to explain now, just do it. No. Human beings, they need to be respected. They need to be compassionately handled, to be told the value of why they are doing what they are doing. Why are you washing hands? Why are you physical distancing and all that? So that would be, making sure that we have that compassionate communication and transparency. And lastly, which is number 6, we give information constantly, but we need to give relevant information. There's so much information on social media. So people are learning from social media, learning from hearsay, but that needs not to be happening. We need information that is solid, that is only small amount of information in summary. The departments of health across Africa, they need to have what we call talking points, maybe 5, 6 points, maybe 5 points, where people are told this means this and the value is this. Not too much information. People don't like absorbing a lot of information. So we need to pump them with information that is relevant, easy, and simple to understand. That's my 6-point plan for Africa. So over to you.
Oh, thank you so much for that. With regards to information, yes. So with regard to information, yes, I can hear you. Can you hear me now?
Yes, I can.
Okay, I'd like to ask, what's your take on new drugs that have been proposed to treat COVID-19?
The last part, I did not hear it properly. Assuming that you are asking my opinion on the situation of treatment.
Yes.
Right?
Yes, not necessarily treatment, but your take on new drugs, like the hydrochloroquine that was proposed by President Trump.
Yes. Absolutely. Okay. So these people need to be informed. There is no treatment for coronavirus. It does not exist. And as a matter of fact, it doesn't even exist for viruses whatsoever. Because let me take a step back to understand what a virus is. A virus is an element which can only exist in a host with a DNA, like human cell, or even bacteria, or whatever the case. It has to have a DNA so that it can get in, replicate itself, and then distribute itself out. Now, the virus does not have, any virus does not have DNA. does not have any center material like any other living cell. So it makes it an element. So it is very hard. It's just an element like iron or any other existing, freely existing element. So when it gets inside the body, it is hard to treat it because most of the medicines or drugs that are available, they go to control or to render the agent or the bacteria useless, or it kills it for that matter, or it pumps antibiotics that make the body kill whatever the agent or the bacteria is. That is not the case with viruses. So we do not have that. Away from that, then we need to control the body conditions, or a combination of things that can control replication. Replication is very important. That's what brings us to hydroxychloroquine. Hydroxychloroquine is a family of drugs of chloroquine. Chloroquine is known to kill malaria, and it has been used in other cases, and it has controlled the replication of the virus in the human cell. I mean, there's evidence that has shown that, but there isn't any long-term study to show that consistently it works for coronavirus, because each disease needs to have a specific control system or drug. So, and then you have azithromycin, which when you have pneumonia, it kills the bacteria, because pneumonia, when you have a certain sort of a virus that affects your lungs, then mucus comes in, or it affects the lungs, and then pneumonia comes in, it is treated with bacteria. So the combination of hydroxychloroquine and to control replication while controlling the pneumonia has been shown to control coronavirus. Now, there isn't a lot of long-term studies, but so far it seems to be working. There is a danger of overusing it. It is usually, normally, if you go to Kenya or other countries in Africa or India, you will find it is usually available across the counter. But since coronavirus, it has really been controlled by ministries of health, and it is now being tested whether it will be the solution that we need. Now, it is recently discovered, it was being tested. So Africa gets the benefit of that combination, but you do not need, I want anyone who is watching, you do not need to run to the pharmacy and get hydroxychloroquine, which might not even be there because most ministries of health are drawing it away from the drugstores. Or you start buying azithromycin, wait, you get evaluated, your condition is different, your viral load is different, but so far we have some light at the end of the tunnel that combination might be as well working. I warn, it needs to be used with advice from the doctor, and so that it can cure someone completely, not halfway. So we have some advantage to that.
Okay. Now, my other question. So, what does the curfew or lockdown mean for persons living in informal settlements? And what is your recommendation?
Yeah, that is a very important question. So far, in some countries, and many countries, we do not have a lot of high prevalence or high frequency of coronavirus. One of the big problems in Africa is informal settlements, which we can call them slums or ghettos. We want to be compassionate, so let's use the correct language that includes the informal settlements. Now, they are highly crowded. That is one of the problems. They are highly crowded, and they have a lot of physical contact all the time. That makes it very vulnerable for those settlements to have coronavirus move from one person to the other very quickly. So there is a danger to that. And I'm talking of, for examples, like Kibera in Kenya, or Mathare in Kenya, and some settlements, Soweto in South Africa. We have a danger or vulnerability as far as that is concerned. Now, what do I recommend for that to happen, or lockdown? We cannot easily have a lot of the causes of informal sector. It is poverty. People do not have ability to have proper homes so that they can be able to live with and ability to have the space they need. So they don't have the space. That lockdown is possible because everybody retreats back to their homes, whether it's a big or small house or in a informal settlement, but they need food. To really kill the coronavirus in informal sectors, we have to understand it requires one person to move it to the other person. It does not move by itself, or someone needs to sneeze to someone else close to them. So first, we give them the masks. The masks, it is not just giving people the mask. And also, they don't have to be given masks. There are now many ways to form these masks because poverty is real in Africa, and governments do not have a lot of money as for that matter. So people have ways they can form, they can do their masks, because all you're trying to prevent is and we need to be very clear, mask does not prevent you getting it from someone else. It prevents you from transferring it to someone else. So if everybody prevents themselves from transferring to someone else, then there is a broken link between the disease transmission cycle. So that is what we are trying to break. So we use masks, but not just give people masks. We need to show them how, or talk to them about disposing them. Because some people get masks, and when they go home, they go hang them in the wall. Then a child can come and get it and say, Daddy has been using this mask. He looks cool. Then they put the mask, they fit it in, and they return it where it is. Now, they don't know whether you had breathed some coronavirus, so they can be transferred. So the government needs to be able to talk about how to control these masks, how to dispose them. When you use a cloth, any cotton that can that is as close knit, fabric, it can also be used. If you look in the internet or you go to YouTube, there are many ways to make that one, as long as you put them on your face. So that is very important. And then no shaking hands. You can't shake hands it's very difficult in informal sectors because they are always used to interacting, but they have to learn a new way, and they have to know that they are doing it for their own benefit, because those are physical things, but they have to learn to believe in the mission. It benefits them, it benefits the country, and the more we stay not following the rules of washing hands, sanitizing, using soap, not shaking hands, the more we not do that, the more we stay within of coronavirus amongst us, and the more it is transferred, and the longer. We really don't have time to stay. We need to reopen the economy. We need to break the chains to the extreme measure where it is not controllable right now. We may have to have total lockdown, like in Washington, D.C., like United States, New York. They to be able to go out unless it's really essential, ambulance, all that kind of stuff. But the government will have to supply food. So the government, like, they are doing it incrementally. Some governments, like in Uganda and Rwanda, they had a total lockdown, but the population is smaller. Kenya is 47 million. We are doing it incrementally. And then some Mombasa, we watch the curve. If the curve rises too much, a total lockdown may have to be taken care of. And
so now I'd like us now to go to Tanzania. Mm-hmm. Yeah, so President Magufuli has not yet closed the country's borders, and he has allowed the citizens to continue working despite warnings on the same, and also despite warnings from even World Health Organization. What's your sentiments on this?
Well, I would like to, for the first time, disagree with my learned colleague of Tanzania that we have just said that coronavirus moves from one person to the other. It does not move by the borders. It has to be an effort, by the way, by the whole world, because we are very connected in many ways. Although now we have closed the borders to cut off coronavirus. So if the borders are open, then people from outside, they are coming in with coronavirus. They infect the people, and those people infect other people. It is danger to Tanzanians themselves. And given some informal sectors that we have spoken about, it can really inflate itself in Dar es Salaam. It can inflate other populated areas. So I disagree with open churches. That is where, and it is proven in Korea, South Korea. I mean, some of these things started in churches, and it just spread around the communities. So we need to have that disbursement of people in communal areas, in social areas, in weddings. We cannot have that open. And I'm talking of that as a person with extensive health background and as a scientist. So I understand that very well. When everybody else puts effort, he needs to put effort as well, so that we can all kill this corona at the same time. Yeah, it is in disservice to their own citizens. I am sure we are all learning. Is also learning, and I am sure the presidents, the regional people need to be real. They can't exist by themselves. They need to talk to their colleague from Somalia, Ethiopia, Uganda, Tanzania. And Tanzania is very unique because Tanzania is also a part of really Central, but also it is very critical that it uses the right measures to control coronavirus, because it's being hit from the south and north. It is similar to where they are also part of South and Central, and it's not part of East Africa or West Africa, but it has multiple pressures of human population migration. Tanzania follow all the other guidelines that the world have seen to work, and social distancing and closing public areas.
Okay, thank you. So I'd like us to come to Kenya right now. What is the current situation with regard now to people even being tested at the community level for COVID-19?
Well, there's the situation in Kenya. I would say Kenya has done a commendable job compared to, they took lessons that are from those countries that got hit very badly, that is in Europe and United States, and they are applying methods that they are not reinventing the wheels. However, there is a little difference because Africa culture, beliefs, attitudes, religions are a little different from everybody else. So the same conditions may not that work for America may not work 100% for Kenya or UK to Kenya. It's not one size fits all. There are still a few modifications, but I commend CS or the Cabinet Secretary Mutai Kagwe for what he's doing in informing people very clearly. I would like to, I mean, we have had deaths, but not in the much multiplication of cases as we have seen in other countries. When they start getting those cases, they start moving up and people start dying, and people also start, there's death. The Kenyan death right now is about 208. We have total of 208 cases as of today. We have 9 deaths. About 40 people have recovered. I think that is a good record. However, on the death part, we need to do more, because when we do the death part, we are, hovering way above 5%. The average international, it's about 3%. So we still, in terms of death, above the infection rate. Not necessarily to say statistical is a bad thing, because our numbers of infections are so low. So any small spike of death kind of shows as if the prevalence is very high. So I would say we are lucky. We thank God for that Kenya hasn't gotten that high in deaths. Now, there is, I would think there is more to do in terms of testing. Only recently, just because a country has low number of coronavirus infection doesn't mean in reality they are that low. The more you test, most of the countries like United States and other UK, they have more than normal because they test a lot. There's a lot of testing. They have kits, they have ability, but they have just recently, yesterday or the day before, increased the capacity to test. They are now able to test like many thousands of people. Before they were testing in hundreds, but now we are able to test and give results very quickly, follow other people, go to different communities. That is where we need to invest quite a bit to make sure we know the status. The whole idea of testing is really to know the status of our people. The testing duration, the return time for the test was 2 days before. Then there used to be more hours, but now the test is about 45 minutes. You get your results, and that is really very good that we are doing that. We will need to watch the situation with the infection so that they can take the strict measures. They have now taken regional locking down. Like, it's not everybody's locked down. The region of Nairobi is locked down. Mombasa, Kwale, Kilifi, and those areas. We have to monitor closely how people are getting infected, so that we can know how we make a decision of whether we need to have a local, a total lockdown. For now, I don't see it very necessary to have a total lockdown. We will need to have also leaders protected. I already the other day made on KBC, I made a joke. Not really a joke, is serious, because without leaders, we are just talking about protecting the people, protecting the health workers, and we need to protect the leaders. Mutai Kagwe, I would like him to make sure that he's following the rules. That way we cannot deal without Mutai Kagwe. We want Matiang'i, when he deals with police, to make sure that he is protected, not with the mouth, or together with the nose. That way he is protected. We want him. I can't imagine, without these aggressive leaders, without them on the front line. So, and make sure they protect the president as well. So let's make sure everybody who is involved, there is no one who is prone. And we also move to police to make sure that we are watching their behavior, because we also need them in the line of duty. So the situation in Kenya so far, I would say it is a B. Given that if they get more money, I'm sure they can do more. And I am sure they have the right methods that work, and they have shown the veracity to combat the disease. I'm sure there are more things the government is doing, considering the food. There's a lot of talk about considering the food, but I'm sure the government is not blind. The government has ears as well. So I'm sure they hear what the common person is saying, and they are taking measures, I'm sure.
Okay.
Okay.
So many countries across the continent have put in place measures now to curb the spread of COVID-19. and among them is curfews and lockdown. So I'd like to ask you, what challenges do you think are coming up with regard to curfew and lockdown, uh, like here in Kenya?
Well, that is a real good question, quite frankly, Valerie. Um, and is it Valerie or Violet? Let me make sure that calling you the right names.
Violet.
The curfew has challenges and lockdown, which the curfew and lockdown, they are two different things. I'm sure the one is a subset of the other. And now in Kenya is only part curfew. It's not a full 24-hour curfew. Uh, the government is allowing people to go and work, services that need to continue. Part of the economy, it has also something to do with the economy, to make sure that the economy, they are trying to do a combination. It is like a combination of a drug to make sure that they are trying to make sure the country does not stop. They are aggressively taking the physical and also the to make sure that the people and they are getting the treatment, but also to make sure the economy is running. It's very important. So the curfew challenge is that the areas of in the ferry area, in the bus stops, in the area of matatus in Kenya, where people cat and mouse games, to make sure that this curfew also conforms to the proven methods that the coronavirus, it is what has been the challenge for the government. Number two, in the beginning, all countries in Africa, they have many challenges. So to lock people down, it means to. So if the situation is not that bad and does not warrant having people at home seated down and being fed, then the curfew at night. And one of the things I think bigger than just having a curfew for people to stay home, because it's not being mentioned, is because at night people go after work to the bars, they go to social clubs. That happens at night in Nairobi and around the country. So that is what, especially those sites, it's not just, most people go home anyway, but there are these social areas that can us very much at night, and that's where people rush to restaurants, coffee after work. And I think that those measures are meant to do that. Lockdown, provision of food, but lockdown is a very strict measure when the coronavirus goes in a very rampant situation. The prevalence is high, people are dying. Actually, I'm very hopeful. This is more hopeful than ever that the measures that are being taken, they are proving that we are not having a lot of deaths, and we are having a lot of people recovering. And also, dying, one person dying is one too many, and one person getting coronavirus is one person too many. So lockdown, total lockdown, as challenges, the government is also listening. So I am sure they will take measures. They are also get prepared in case the disease goes out of control, then they can be able to give food or do some measures. No government, they can hire the best scientists, they can hire the experts, people with good knowledge. They have done that, and I'm sure some of the things I'm talking about, someone else is advising the president, someone else is telling Matiang'i what to do. So there is also a message of hope that it is not all bad, but the government needs to be ready of all areas, just in case we can also be able to lock the country down. I'm hoping we don't get that at that point. I see CS Matiang'i and all everything they can. These people don't even sleep.
Yeah.
So we expect this to be under control.
All right. Thank you. So I'd like to, my next question is with regards to now the people who are living in the rural areas. They have this assumption that corona is in the city. It is not in the rural areas. What is your message to them? Because I think this is also a case that is replicated also across the continent. What is your message to the people who are in rural areas?
So in rural areas, like in unlike other countries in United States and United Kingdom and other cities have taken over the populace. We are talking of most people in the United States or most people in the UK. They live in urban. The difference in Africa is that the rural areas, actually majority of people in Africa, they live in the rural areas. Maybe out of 47, over 30 million live in rural areas. Only in Nairobi and Mombasa and Nakuru, there is the rest of the population in a few millions. You realize the patterns, and that's why it's important to have public health statistics at work. Public health is a very serious item, and research and development. Africa really invest heavily on research and development. Rural areas, mostly the demographics is older people without a lot of money, unskilled jobs, because the rest of the people from the universities, they came to the cities to look for skilled work. So we are in rural areas. A lot of people who are very vulnerable, they don't have access to very good healthcare in rural areas. So if corona got into rural areas, the government of Kenya is right for closing the borders from the big cities so that people do not travel to upcountry and infect people who are already vulnerable and the people who have certain diseases. So is now a challenge, but the challenge and discomfort is correct, and it is okay. The borders from the main cities are closed so that they do not infect a lot of people in up country, especially Shushu, especially the grandparents, moms, and people serious health deficiencies. So, and they are the most in any case. So we still have to, away from the city, the information in the city goes fast because there's TV, all these social media we are using right now. But in rural areas, a little different. People need physical people that are visiting, that are talking to them about information that they understand. So corona message needs to be translated into all languages so that people can understand what it is. We want to have community workers in the communities talking, advising, and telling people what to do and making sure they do the washing of their hands. And they all now there are people who don't even know there is curfew. And if you catch all of them, where are you going to take them? So the money that we get as foreign aid, we need to invest on time. It is time to have youth be included in community service, in advising the people. They can go and advise the people what to do.
All right, thank you. So lastly, going forward, we can see that the coronavirus or COVID-19 is having an economic impact, not only across the continent, but also globally. So what is your recommendation maybe to countries on how to restore their economy back?
For Africa, they face similar challenges, and we want to make sure not collapse under the coronavirus conditions. So the countries in Africa, a lot of and I submit that many loans are not always given the feasibility are necessary across Africa. In some countries, that the loan does not always carry out what it's supposed to do. So a lot of countries in Africa are loaded, usually from IMF, from China, from United States, from other countries. Now it is time to renegotiate not only, but also surprised that loans from IMF or World Bank, the interest rates, I find them very high in Africa, but the big places, the loans that are given from IMF, they have like very low interest rate, 1 or 2%. They contribute more to IMF and so forth. But it is time Africa to stand up to be able to first make sure that they can be forgiven certain loans, because already stopping economies of Africa, the economies, it has really devastated some small countries. They will need to get them started. So they need to renegotiate to see whether they can be forgiven, renegotiate the terms, renegotiate the side. That is for the bigger country. But there are also people who are working in businesses with things called small business administration loans. I'm just trying to make where many people do not have good credit because of the corona. So the credit needs to be reconsidered so that people can get unsecured loans, depending on the amount, through government guarantees, where the government, let's say small business administration loan, they can distribute, give money to prospective business people. These people do not need to show up business as up a shop. No, they need to prepare business comprehensive business plan. I'll tell you today, most people, even in Africa, if they prepared a comprehensive, they will not even be in the business they are doing. Kick tires in every way, asking them, who are your customers? Who are the markets? How will you gonna penetrate in the market? Because when they answer those questions, they will be like, I can't, because there are many competitors, there are many factors pushing me. Maybe I need to change to a different business. So to plans, not youth, there's money for youth. It needs to be, and then the money doesn't need to be given in full. If the business is asked for money, let's say whichever currency, the Africa currency, and then the milestone, you told me this a quarter, we'll reach this point, let's come and inspect. After that, I'll give the next, we'll reach 50%. So there is no misapplication. So the small person needs to be given opportunity, using the right mechanism. They can be able to do business easily. Number two, to make it easier to do business. In other words, the barriers of application, getting the license, because 75% of all countries across the world, and some higher, the economy of that country it's driven by small businesses. It's not driven by big companies and big airports. No, no, no. Those are given tax breaks. And those tax breaks people because government only survives on tax breaks. So they hire the people, but also they don't pay the money. The person who is carrying the government is middle and lower in who we need to be able to target and make sure that uh, we can get the economy back on the road. Now, the bigger issue is not even doing the mechanics and the engineering of in the government will do the right thing. So the government in Africa, they need to get back into prudent governance, where people, when they government acts, Corona has really told governments across the Africa something, that there is one time government needs the people. In other words, they need people cooperation. A lot of times government and you must cooperate, you must do this, then you must do this. But Corona has taught us that the government at some point will need people to cooperate. And when there's a good working relationship between the government, and the government needs to take the lead where there is transparency. Like now, when you tell people 208 people are dead in Kenya, you still got some people on the social media saying that number is not true, or we know it's not true. The reason is that there needs to be a way the government now starts serving people on terms of believability, integrity, honor, in the government, where people can believe again when they play hard, when they work hard, play by the rules, they actually can get where they need to get, especially the youth. Now, the masses, the biggest population that will answer questions when government needs them is the youth. 75 to 80% of African, sometimes more, 75% to 85% of African population is youth, 34 and under. So that group needs to be catered for, because when you need them, they need to work in unison. CS Cargo asks youth to participate, but the kind of comments that I saw were not very encouraging on social media, that you now need us. Before you didn't need us. At that end, I would like to see now we get into prudent governance, and it can be done. Kenya can be a shining star on the hill and a gateway to Africa. I'm completing a book that is called Kenya Governance, a Restoration of a Nation, where I put all these things together, including my experience as a presidential candidate in 2017, some of what the right way to do things, so that I can execute my duty as a patriot, and say, this is the right way to do it, whether it is done or not, then at least someone said it. And I have done a lot of good investigation. As a matter of fact, I need to mention this, that in research and development, the scientists in Kenya, they have done a very good job. Kenyatta University students are doing work. KEMRI has come up with something that can test in 15 minutes, test the coronavirus in 15 minutes. There are other people coming up with all sorts of equipment and, all sorts of making masks and so forth. What I want a government to do, particularly government of Kenya, is to now open up channels of funding research and development. And sometimes we talk about, are you doing anything? I have been talking to even, and I thank him a lot, Governor Mutua of Machakos, we have been talking. I think we've spoken even last week regarding how we can get research sciences, round them up, and we begin something that is robust. There are some cases that do not need even that much money, but I have a feeling that they are demotivated, and we can, in many cases, have our own African solutions, not just our own. There's a reason, like in diaspora, we have more doctors in diaspora than we have in the whole of Africa. We have more engineers and professors in abroad, brain drain, than in the whole of Africa. And what are they doing abroad? They are developing drugs. They are teaching people how to do this. I do. We have doctors who can do research and do it properly. As long as we give them the channels, they will come and make Africa independent of disease, good public health. And I have also, which will be in my book, I have a comprehensive plan of how to deal with diaspora. I've lived in diaspora almost of my education. I lived between Kenya and Washington, D.C., do projects there, but I'm based in Kenya. So I understand diaspora because that's where I went to school. And the potential that is in diaspora, if it is not tapped, it will be like a waterfall with a lot of energy, and it does not produce electricity. So I want government to be able to look into those as part of lessons in Africa to reduce cost economically as we bring our own. They can still live abroad, but they come and do things that we do not have to import other things. Well, there's more complication in terms of why we import, in terms of corruption and other things, but I am a patriot, so I wanted things to be done the correct way, and I'm looking forward for a prosperous Africa.
Okay, awesome. In connection with what you have said, in 2001, African presidents signed the Abuja Declaration, where they stated they will allocate 15% of their country's national budget towards health. But at the moment, like in Kenya, it is at 7%, and even the situation as it is at the moment, you find that the elite right now can't travel abroad to seek for better hospitals. So what is your message to them? Should they increase the budget allocation towards health in their respective countries?
Yes, the answer is yes, yes, and yes. It should, in my opinion, it should reach 30% in a very quick succession, because Corona have taught us that our healthcare systems in Africa are very fragile. They are not able to, they don't have the capacity to do what health needs to do so that it can have the outcomes that are needed. We are doing it in bits and pieces. Like, for example, the zero campaign. The zero campaign. It is with Margaret Kenyatta. Those are some of the policies that are being applied across the world. So we are doing it in some areas like those, and they are successful, mainly because of interest in health. That's why I see a lot of benefits in her. But 7%, it is very low. Let me just say that. And Kenya is trying, but they are much lower in many other countries because of poverty that is involved. So we need to have to increase the percentage. And like I say, and development of medicine, and we have the human resource, which is the people, the diaspora, and other people. Africa Union, I think it is slowing down. Africa Union is not doing the maximum it should be doing. It should be monitoring, it should be pressuring, it should be producing data that gives report to fellow African countries to them that compared to health outcomes, the application of financing or funding is not commensurate. There is a missing link of data, African data, compared to why the health, because in Africa we have different culture, beliefs, and attitudes and religions. So these come from one region to the other, and we need that kind of database to be established. That way, Africa lacks data. Do you believe Africa goes to CDC for data? Do you believe Africa has to go for nations who collect data in Africa? Seriously, what happens to our health scientists, data collection people? And this is not data. You even that, and this needs to be specifically in health, because you cannot just collect data if you do not understand health properly. You end up having data. There's data being collected by the wrong people. The right people have to collect data, because the data has certain meaning. And once you collect it, you are not easily able to go back where you collected it and rectify it. You are gone. So we need the setting, the setup, the designs. We need, and I'm telling you, there is a lot of this that must come from diaspora. Diaspora has a lot of, so confident the solutions for Africa, most of them will come from diaspora, if they get together also, because the diaspora have to organize them as they should be. But they are busy doing that data collection. They come to Africa, collect the data, take it to United States, in the UK, in Switzerland, and then they supply the data back to Africa to tell them, oh, you guys, you are so much in slums of Kibera. You are not able to travel from one place to the other. That data is being produced in other countries. That is like not acceptable. So if we increased and I wish our president will listen to this, or someone will tell him that the research and development, it's very important. Data, we are all controlled by data, and maybe subconsciously there was an advantage to Huduma number, which was in a way, one way or the other, was politicized, maybe correct, or maybe the transparency wasn't there. But there is an importance of knowing your population in terms of numbers, demographics, people, place, and time, so that you advantage, but there also needs to be assurances of security. So instead of people rejecting the Huduma number en masse, or the registrations like en masse, rejecting everything, we need to be able to rely on data. And there is no other way, particularly in public health, we can be able to solve things without knowing where people are, who they are, where they live, and what they are doing in particular time. So it is very important in Africa to have increased health funding. Like, for example, in many level 5 hospitals or level 4, you're going to find that they are treating wounds in Kenya or in other parts of Africa. Why would they be treating wounds? There are dispensaries and other areas to do that. So you find our health system, it's being overloaded the wrong places. You find HIV, the testing center for HIV, only 3 people comes per week. But then you have to go to the hospital or to the doctor so that they can refer you there so that you can get tested. There needs to be integrated services. They shouldn't even exist at all. But because they may be being funded from other countries, some people want them to exist so that the money comes in. But there should be a different lab for HIV, and then there's a different lab for the hospital. There needs to be integrated. So there needs to be cleanup also in hospitals to see what works, what doesn't work, and make it very efficient. And talking about what works, doesn't work, economy, the governments, they need to use measures to cut cost. There's a lot of waste in African governments for one reason or the other. They need to use measures like Six Sigma processes to be able to follow every little process to the end, to see how much it costs or wastage. There's a lot of, I've seen, I wouldn't mention names, when you go to some offices, you find people almost sleepy. They are doing nothing, and it is government office. And you really need to have those people working, or show them things to do, available things to do, redefine work processes so that you can increase the production of the people in offices. So They don't say, I didn't have anything to do. No, there was data to be collected, or we can do this. We can redefine even their work, their work description to get maximum from human resources. So I'm very passionate about Africa because I know they are very resourceful. They have produced great people across the world, and they are intelligent, learned, and able to care enough. Look at you. You care enough to ask these questions. So we appreciate you too, Miss Violet.
All right. Thank you. Thank you. Thank you, sir. Honorable Dr. Jeff Kaluyu. And you stated that you'd also like to vie again in 2022. Is your political aspiration still there?
Yes, I am always ready for duty. And whatever the Kenyan people will ask me is what I will do. That sounds more biblical. Here I am, send me. I continue to consult with the people on the ground to see the best place to be. But definitely, as we do things in Kenya in 2022, I am shaping the opinion. If you go to my social media accounts, I'm on the ground in schools. I am on the ground in the local communities with women in Kitui, in Nairobi, working with diaspora, anywhere I can be able to touch. Because I believe, first of all, leadership is not about elections only. If you are called to duty, to lead, you lead whether you are elected or you lose an election, you continue to lead because that's a calling. I continue to serve our people in various capacities. Those who come across me, they know I do that, and you can visit in my social media accounts. In 2022, if you are a leader, you are always ready for duty, and I expect to be a part that shapes that election. I'm better, wiser. I know more of how things work. Politicians where I'm just making noise for, I have solution. I feel I have solutions, and I will be ready with manifesto if God willing reaches us there, or we are able to get there with good health. I am hoping to shape election, but the most important, it is not me to say. I'm always wary with many people who say, I'll run for governor, I'll run for president, running for the office. They kind of rush into it. But these are things that require deeper thinking. They require careful plans, design also in accordance to what people on the ground needs assessment. This is not a place you just take off the ground and just go to the crowd and elect me. I believe in 2022, if people get it wrong, I'm more worried what happens after the election more than the 2022 itself, because the election will determine how the next governance, the next leadership, the next way of life for Kenyans will be. So, to your question, I'm ready for duty. I'm consulting with people on the ground. What they send me.
All right. So thank you, Honorable Dr. Jeff Kaluyu, for joining us on this platform. And thank you for the insightful information that you have shared. We are really grateful. So, asante. All right. And I'd like to ask the viewers that if you've not yet subscribed to this channel, kindly do so that you can also get updates when we host new guests. So thank you so much. Thank you. Thank you, Mheshimiwa. And see you soon. All right. And I wish you all the best in your endeavors. Asante.
Thank you so much. I appreciate, and you're doing a great job. Violet, we wish you the best. I'm a champion for youth. And as a youth who is concerned about her country, about Africa, I would like others to follow your cue and continue doing good job. We appreciate you, especially women empowerment. I'm all about that too. God bless. Appreciate.
Okay. All right. Thank you. All right. Thank you as well.
Anytime.
And thank you, everyone. So see you in the next live broadcast that we are going to do this week. All right. So thank you and enjoy your evening. God bless.